Hello, 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 my dears. Hello, my champions. Welcome to the video dedicated to mental health awareness. The main purpose of this video is to raise awareness of mental health. And I will tell more today in this video about some symptoms, some mental health issues, some personal disorders, and I really would like you to understand that words I might use in this video, such as problem, issue, etc., etc., they are not about insulting you or being rude. So please don't take it personal. Please don't think that there is something wrong with you, that there is something bad about you. No, these are just facts. And as I said before, the main idea is to raise awareness, is to highlight that there is a problem, that there is a fact when something is not working well or as it should work, and for you to take care of yourself when you still have this time. My name is Natalia. I am a professional certified life and business coach, and I also work as a practical psychologist. So, in this video, I will tell you about some symptoms that might look for you as something that is not important, or mental health. These symptoms can cause, or not can cause, the symptoms show that you might have some mental health issues or personal disorders. However, the symptoms I'm going to list in this video doesn't mean that you have any disorders, mental health disorders or personal disorders, because to diagnose the disorder, the doctor is needed. So please don't put the diagnosis on yourself just by watching some video on YouTube, right? Not a life coach nor psychologist can diagnose mental health issue. Of course, I can see some, let's say, signs or symptoms. However, to diagnose these particular mental health or personal disorder issues, to give a diagnosis, you need to be a doctor. So it depends on your country, but psychiatrist it's a doctor, right, who treats the disorders with medicaments. This person for sure has a right to diagnose it. However, when we are talking about mental health disorders as well as personal disorders, medicaments are not the only options you should consider. Please, I will talk about it maybe in some other videos. Please note that if you have, for example, depression, and you are taking medicaments, and it's important to take medicaments if the depression was diagnosed. It's not just you are making up, right? It's important to talk to a life coach, psychologist, maybe life coach and psychologist, maybe also psychotherapist, because these professionals, they work in a different methods, they have different goals, and it's important for you to change your mindset and behavior to make sure depression does not come back, because medicaments, they just, let's say, they treat, they cure kind of the fact that you have it. However, there were reasons, there were some circumstances, there were some actions, there were some red flags you ignored that brought you there. So, why mental health awareness? I really think that it's, especially now, so important to raise awareness. And I consider this one of my missions, to raise awareness, to be an advocate for your mental health, for your self-love and happiness. Just listen to these statistics. According to World Health Organization, every 40 seconds, just listen to this number, every 40 seconds, one person commits suicide. I've been talking for about 3-4 minutes now. So it means at least 6 people have died by committing suicide while I'm talking. Can you imagine this awful number? It's unbelievably scary. There are no words to describe this tragedy of our society. When people, instead of taking care of themselves, instead of slowing down, because nothing, I repeat, nothing in this world is more important than you and your life. Not your career growth, not your success, not even your relationship, not you being comfortable and convenient for everybody, not you being a good person and smile at everybody. Because all of that doesn't matter when you stop living. And these statistics, if you look at statistics, it's in open sources, so you can just Google it. Statistics on mental disorders registered. Because unfortunately, a lot of people live with depression, anxiety, social phobia, schizophrenia, bipolar, etc., eating disorders, obsessive thoughts and obsessive compulsive disorder. And even they don't know that they have some problems. They think it's just their personality or laziness or just the way they are. They don't understand that it's their body, their organism, their brain, if you wish, is trying to tell them, please take care of me, please notice me, please change something. So please, take care of yourself. Realize that stress or you avoiding meeting people is not something to make jokes about. Is not something to have fun about. It's a serious problem. It's a worldwide. 40 seconds. Every 40 seconds, one person commits suicide. So whenever you start making jokes about someone being stressed or upset or depressed or too emotional or whatever it is, or if someone makes jokes about you or people like that, just consider that. Consider that statistics. Keep that in mind. And keep in mind that mental health issues could hide very good. And some mild symptoms that could come unnoticeable for decades. People can have depression for decades without realizing they have one. People can have anxiety for decades without realizing they have one. And instead of taking care of themselves, taking actions before it's too late, they just say oh, I have stressful job, oh, I have bad relationship, or I'm just too tired to do something. you are worth it. You are worth it to live your life. And there is no such thing as unresolved problem. Everything, in a way, could be treated. There are some personal disorders. I'm not psychiatrist, and the point of this video is to raise awareness, not to educate, not to give you educate in a way for non-professionals, right? Not to give you some diagnosis, right? However, for you, it's important for you to understand that you and only you are responsible for your life and for what's going on in your life. And yes, some let's say mental states, some personal disorders, they can't be cured 100%. So person have to learn to live with this. However, medicaments, psychological counseling, life coaching, etc., different kind of therapies can help and can reduce the bad outcomes of this of particular mental health disorder or personal disorder. And continuing with this topic, I would like to emphasize that there are different reasons why person constantly or from time to time experience some mental health issues. I would like also to clarify that at some point, I strongly believe in this, at some point everyone in this life experience some kind of mental health issues. Let's call them just mental health symptoms, because when for a couple of months you feel that you don't want to see other people, and you're avoiding crowds, or if let's say you have lack of empathy, that's a narcissistic disorder, for example, right? So and this also can't be cured 100%. However, at some point we all have some difficulties, some stress, something to cope with. So our psycho needs to cope somehow with what is going on. So basically it's a normal reaction on some situation. For example, if you lose someone, or if you lose a job, something or somebody that is valuable for you, it's okay. It's a normal reaction to feel sad. It would be abnormal reaction, for example, to feel okay, again, it depends on the situation. However, it would be not very common to feel happiness, right? And again, it all depends, because our mind is a very tricky thing. Yes, it works by certain rules, like a computer program. However, the variety, how this particular person can react on something, is endless, like literally endless. So the reasons of mental health issues. First of all, of course, is genetics. Some personal disorders, some mental health issues, they are in your genes and there is nothing you can do about it. Some people are more, they more tend to have, for example, depression, or let's say some eating disorders or anxiety. Personal disorders or some, let's say, very heavy mental disorders, they, of course, in majority, they are genetics. It means that something happened. It could be inherited from your parents and grandparents, etc., or some let's say, error. But again, it doesn't mean that you are bad or something is wrong, right? I'm just naming facts, all right? So, for example, during pregnancy, there could be some errors. So the brain formed in particular way, and somehow important parts of the brain were formed differently. For example, psychopaths, they don't have empathy at all. So these people, they can't relate, they can't feel your pain. Because what is empathy? Empathy is when we, let's say, feel other people, and because we feel other people, we don't want to harm them. So psychopaths, for example, they don't have this thing. They don't have empathy. So if you tell this person that if you do this, I feel bad, please don't do this, this person like doesn't understand, like, what are you talking about? Like, let's say they literally don't care because they can't. And you can't negotiate with this person, you can't change this person, because this is how the brain functions. But I'm not talking today about severe mental health issues or personal disorders, because it's, well, what can we do? It's psychiatry. These people shall be treated in some hospitals, or they should be taught how to behave in society, not to be dangerous for themselves and other people. All right? So genetics. The next reason could be environment and circumstances. Here I also put the stress, right? If you have stressful job, if something happened recently, you lost somebody, or let's say the whole world is actually stressed out. I've been talking and repeating this for like several months already. A year and a year and a half. When did it start off? So the whole world is stressed out, and thinking that it doesn't influence you is not positive thinking, it's ignorance. Because if you see your friends losing jobs, getting sick, all people, like the whole world is stressed out. And the first step to mental health is to recognize there is a problem. There is something going on. Because when you don't realize, when you deny it, you can't actually control it. But when you realize it, you can control it. You can deal with this. You can solve it. You can find the solution, and that is very important. I really would like you to remember that, write it down. This is one of the most important insights I would like you to take from watching this video. So, circumstances, environment. If you live in a peaceful area where like no noise, like birds are singing, people are happy, and everything is peaceful and safe, most likely your mental health is doing just fine. However, if you live in megapolis, if it's like noisy all the time, if it's high level of noise and stress, because every day you are going out, you are taking subway, I don't know, riding a taxi, whatever, train, if you work in a noisy environment, if at your job, at your workplace, they demand too much from you, and like you feel pressure all the time, and that people demanding from you all the time during your day, well, most likely at some point you'll have one or another mental health issue. And that's nothing to be scared about. It's nothing to, please don't deny it. Because when you deny, you actually harm yourself. And that's actually very important disclaimer I also would like to add to this video. if this video somehow triggers you, if you feel that you disagree strongly, or you don't want to listen, you think I'm like talking nonsense or whatever, it means that you are like strongly denying. Your mind is blocking this information. This is a red flag for you. This is a message for you that you need to take special care of your mental health, because sometimes it works like that you're like denying everything, no, I'm fine, and then bam, and something happens. So if this video somehow triggers you, you feel irritated, aggressive, etc., you can just turn it off and then watch it later. However, this is the sign for you that your mental health is in danger. So please take care of yourself. Now let's talk about symptoms that could look like your personality, nothing important, nothing serious, but actually could be symptoms of mental health issue, problem, or disorder. Let's start with focusing on your body image and your weight. If you can't eat something without thinking about calories, about fat, about your body, if you have obsessive thoughts about how much you weigh, what do you eat, about exercises, etc., congratulations, there is a high chance you have an eating disorder. Especially if you have some symptoms of anorexia or bulimia. If your weight is too low or too high, we are talking about obesity now. We are not talking about extra 5 kilos, right? We are talking about people whose weight is, I don't know, 10, 20, okay, maybe not 10, 20, 30, etc. kilos more than it should be according to statistics, let's say, yeah, because for each age, for each height, there is a particular amount of weight, and if this number is too high or too low, this is a sign for you that you need to take care of yourself. If you can't sleep, if you have obsessive thoughts, if you are have obsessive actions, for example, you are cleaning, and I'm not talking about cleaning, I know, twice per week, just, you know, making sure that everything is more or less in order. I'm talking about constant cleaning that doesn't let you go. So if you are not cleaning, it really bothers you and it irritates you. Again, most likely you have a mental health issue. If you are ignorant towards your hygiene, if you don't take shower, don't brush your teeth, if you don't care about how you look, most likely you have mental health issues. If you feel upset and sad all the time, if you feel guilty or not good enough, if your self-esteem is too low and you are afraid to go out and it's hard for you to be in public, most likely you have a mental health issue. If you are easily irritated, if you are too emotional over something that is not very important, if you either cry all the time or laugh, or if you have mood swings very often during the day, 1 hour you're very happy about without no reason, and I don't know, next hour you are like crying, most likely you have a personal disorder, mental health issues. If you are aggressive and if you lack empathy, if you don't care about other people's feelings, and if you just think of people as your as somebody to satisfy your needs, most likely you have mental health issues and personal disorder. If you are feeling that someone is hunting you, if you can't relax, if you think that you have some diseases, or that you are not safe in the place that is safe. If you feel this danger all the time, most likely you have mental health issues. I've listed a very limited amount of symptoms. If you have noticed any of them or several of them, please take care of yourself. Start with reading, start with counseling. You can book a session with me. I hold them online, so from all over the world I can help you. Doesn't mean we're in Africa, United States, I don't know, Europe, Australia, South Africa, South America, doesn't matter. Find another coach, psychologist, or psychotherapist. Visit your family doctor. Observe how you feel, what do you think, how do you act during the day, because this is very important. And to finish this video, please note that by this video you can't diagnose your mental health issues. You can't put a diagnosis by yourself that you have some problems, right? This is not the purpose of this video. The purpose of this video is to show you that some, let's say, tiny things that you can ignore that are happening in your life daily could be signs of mental health issues. Or if it's very, let's say, if it's too emotional name for you, I can say that these are the signs for you to start put intention, taking care of yourself, to start choosing yourself. So instead of being good for everybody, start being good for yourself. It doesn't mean being rude or bad towards others, of course not. However, if you take care of yourself, it will be easier for you to take care of others. And can you imagine the world where every person is responsible and takes care of him or herself or themselves? We will live in a much, much, much better world. So the better world starts with you taking care of your mental health. Because as I said, it's not funny. And for decades, you can think it's your personality, it's nothing serious, it's just who you are. And then unfortunately, some events could come that you might not change. Okay? So, if you noticed any changes in your behavior, if you see some symptoms that could be a symptom of mental health disorder or personal disorder, please observe them. And also please note that if you feel sad sometimes, if you don't want to brush your teeth and go to take a shower on Friday night because you are too lazy, if you prepare for a date and you look in the mirror and you're like thinking about your weight and your body image, if you feel angry when your boss is screaming at you, if you feel upset that your friend is ill, this is okay. Those are normal reactions. So please don't overreact. Please don't worry. It's okay to have mood swings sometimes. It's okay to be sad sometimes. It's okay to be super excited sometimes. It's okay sometimes not to care how do you look because you are so tired and you just want to sleep. It's okay sometimes to care too much about your looks, especially when you are meeting some nice person or you have an important interview or whatever. So if it happens from time to time when the circumstances are right, what do I mean by that? If you are meeting a new person, of course you are excited, of course you would like to look fine. if you are too emotional when you are watching a romantic movie, or I don't know, you just gave birth to a baby and hormones are like playing, they're having fun in there. It's okay to be emotional. I'm talking if it's more than 6 weeks. For example, if more than 6 weeks you are feeling upset, sad and depressed, that's time for you to think about visiting doctor. If for more than 6 weeks you are too obsessed with your body image, it's hard for you to eat normally. Yeah, because food is something that brings us joy, and food is something that actually gives us life. We can't live without food. If it's more than 6 weeks, you're like focusing on what do you eat, how do you look, if you gain, I don't know, 5 pounds, I don't know, if your waist changes for 1 centimeter and you're like, wow, oh my god, it's time for you to think that maybe it's not about food or your body image. Maybe unfortunately you put yourself into mental health disorder. And please note that mental health issues, they don't occur just, out of nowhere. It means that probably you ignored yourself for some time. By ignore, I mean that you were doing something else, but not loving yourself or taking care of yourself. By ignoring, I mean when you were using alcohol to relax every Friday for 10 years. If you say that you need alcohol to relax, most likely you have a mental issue. If you are afraid to build intimate relationship with people, close long-term relationship, most likely you have a mental health issue. And this didn't occur like out of nowhere just right now, right? So before you had probably some traumatic experience, and instead of going to psychologist, going to relationship coach, going to life coach, talking this through, finding solution, you decided to ignore this. When you can't sleep for over a year, and instead of going to psychiatrist, family doctor, life coach, counselor, personal counselor, you are just saying that it's just stressful work, it's just too much to do at home, etc., etc. Some, as I said before, some mental health disorders, personal disorders, like there are some disorders that people are born with. But if you were not born with this, it was your choice to make your life like this. And I'm not blaming you. Please don't feel guilty. Feel responsible. And that's a very different feeling. Because when you feel guilty, you play victim and you can't do anything. I'm giving you power because you can resolve anything. As long as you are breathing, everything has a solution. It could be not that obvious, it could be not that fast, but it is there. And there are a lot of people ready to help you. Please be the first person to be ready to help yourself. Take your mental health in your hands. Start feeling this power that you can actually guide your life wherever you want. And probably for some of you, taking your mental health in your hands could be just turning on relaxing music, having a nice walk, playing with children, talking to your spouse or friends, watching a nice TV series or a movie, Maybe drinking juice just a bit or eating something nice. But be careful if you have these issues with food and drinking and other things. Please don't please, again, think about yourself. No matter what you do, try to do it as if you'd love yourself. Would you do it? Would you choose this? Would you act like this? Would you keep doing this? All right. Take a deep breath, smile, recognize and acknowledge if you have some issues, some problems. It's okay. There is no shame, there is no guilt. As I said before, everyone, once in a while, we have some things that we just need to solve. And we will keep living, and hopefully happily. I wish you health and happiness. Stay tuned. Recognize yourself. Take care of yourself. Take care of others. And please, please choose yourself, and remember, you are worth living. Okay. Thanks for watching. See you soon. Bye bye.